Chair recognizes the Senator from Cumberland, Senator Woodbury.
Thank you, Mr. President. Mr. President, Senator Cates is an articulate speaker, and I agree with the large majority of points that he made, and he made them exceptionally well. Well, there are 5 lenses from which I look at this bill and this issue, all of which lead me to the same conclusion on which way to vote. The first lens is one of what I'll call human compassion and fairness. I have health insurance. I'm actually eligible for health insurance from my wife's employment. I'm eligible for health insurance from my own employment outside the legislature. I'm eligible for health insurance as a legislator. I'm eligible to buy insurance on the subsidized federal exchange. And even if I didn't have any of those options, I feel I have an income where I would go out and buy health insurance privately because I think it's important to have and I can afford to do that. Those who would benefit from this bill don't have even one employer offering them coverage, and for whatever reason, don't have enough income to reasonably afford to buy health insurance privately. Now, when I or they are in good health, that difference may not be that big a deal. It matters to some degree with preventive care, but it's not that big a deal. But if something happens to our health, cancer, diabetes, kidney disease, hip fracture, the difference matters a lot. I'm no better than those without this coverage, nor more deserving of treatment than those who would be covered by this bill. So there's a fairness argument that is very important to me in evaluating this. The second lens is one of the cost shift associated with unreimbursed care. This is an argument we've talked about quite a lot on this floor. When providers, hospitals, physicians need to provide care that is unreimbursed, they need to make up for that cost through the prices that they charge to those who are insured or those who can pay for care. I've spent a lot of time this session with the Price Transparency Commission and actually had a bill to increase price transparency. And part of that has been to just make people more aware of how much health care costs. And I must say, a side reason was to create a little bit of outrage as to how much the medical profession charges for things that don't seem like they should need to charge so much. Well, a big reason that they need to charge so much, one of the big reasons, is the fact that they need to make up for the care that they're providing in an unreimbursed way. This bill helps to deal with that problem. The third lens is the economic issue, and Senator Cates expressed that quite well. I've sat this session on the Workforce Committee. We've had huge number of examples of businesses that have come and talked about their story. Their story of, for example, getting a $50,000 MTI grant that helped them to develop a new business, a new product, new business model that led to their success as a company. We heard about companies that may have gotten a $200,000 FAME loan guarantee. This is all good stuff that has been great for Maine's economy. But I have to believe that this pales in comparison to the $340 million that could come into Maine as a result of passing this bill. And again, as Senator Cates said so well, what's amazing about this particular economic development incentive is it's not targeted to one place. It is being spread diversely around the state, and in particular in higher concentrations to places where there are people with lower incomes and higher unemployment. It's exactly the kind of miracle economic development initiative you'd try to create if you were thinking about what to do to help the economy. So there's an economic lens that I think brings one to think this is a good idea. The fourth lens is the one I think I talked about actually both last session and maybe last year in this session. But the notion of how to make our health policy system more rational. Whatever you think of the Affordable Care Act and its complexities, and it certainly has its share of complexities, one of its key visions was to make sure that there's an affordable health insurance product for people in any economic circumstance. And the segment of the market is some people are, over 65, you're eligible for Medicare. If you're working for an employer that is providing you with health insurance, you get your health insurance through your employer. But for everybody else, the question is, how do we deliver an affordable health insurance product for people with different economic means? And what the Affordable Care Act envisioned was that those with incomes below 138% of the poverty line would be in a Medicaid program. Those with income between 138% of poverty and 400% of poverty would be eligible for subsidies through the private marketplace, the health insurance exchanges. And those with income above 400% of the poverty line would have a level of income that was sufficient to be able to fully pay for insurance in the private market. That continuum, that vision, is what made it possible for people in every economic circumstances to be able to have health insurance. If we fail to provide that bottom piece, that health insurance to those below 138% of poverty, we've really failed with this entire vision of creating an affordable product for people in any economic circumstance. The fifth issue is one that Senators Cates and Senator Saviello should be credited with bringing forward to us. We all know throughout our reading of the newspapers before we were legislators and looking at the issues and the challenges that we've faced as legislators, that the Medicaid program is a very difficult program to manage well and is often not managed very well. Listening to Senator Cates speak about some of the aspects in this bill that are going to help us to move to a Medicaid system that is better managed, to me is extremely inspiring in fixing something that has been difficult to accomplish in the past. So integrating that in to this Medicaid expansion, to me, absolutely enhances and makes this all the more important to do than it already was for the reasons that I just discussed. Mr. President, we do need incentives for people to find jobs and to gain the skills and inspiration to pull themselves out of poverty. But rejecting this offer of health care coverage to people who need it is not the right way to do it. Thank you very much.
The chair recognizes the senator.